about controlling blood sugar. Most of us picture long walks or intense exercise. While these are undeniably beneficial, there's a practice that works differently. It engages our physiology at a cellular level, triggering a cascade of metabolic reactions that walking alone cannot. Imagine a mechanism where your muscles become sugar-burning engines without demanding hours of cardio. Doctors observing patients with prediabetes and insulin resistance note that introducing this habit consistently can create measurable improvements in blood sugar regulation, often more rapidly than traditional approaches. It's fascinating to realize that our bodies are designed for movement and rhythm, and yet, the type of movement matters profoundly. The moment after we finish a meal is often overlooked, yet it represents one of the most powerful windows for influencing our metabolism. Blood sugar begins to rise, insulin is secreted, and our bodies are engaged in an intricate balancing act, carefully orchestrating how glucose is absorbed, distributed, and utilized. Most people think of exercise as a way to burn calories at any random time. But the truth is that timing is one of the most decisive factors in controlling blood sugar. Postprandial metabolism, the way our body processes food immediately after eating, is a dynamic process that can either support or undermine our long-term health depending on how we interact with it. This is the moment when our muscles, the largest reservoirs for glucose, are most receptive to taking in sugar, and when insulin, the hormone that signals cells to absorb glucose, is most effective. By aligning movement with this biological window, we can dramatically accelerate the clearance of glucose from the bloodstream. Doctors who work with patients experiencing insulin resistance have observed that even gentle movement after a meal can significantly improve postprandial blood sugar levels, often more effectively than prolonged periods of exercise performed at unrelated times. It is fascinating to realize that our bodies are not just machines that respond to arbitrary activity, but are highly attuned systems that optimize energy flow when given the right cues at the right moments. Timing, in this sense, becomes a form of dialogue with our metabolism, an opportunity to guide ourselves toward efficiency rather than letting sugar linger in the bloodstream, contributing to oxidative stress and inflammation. When we examine the science more closely, we understand that glucose in the blood is not inherently harmful, but its excess, particularly after meals, is what strains our metabolic systems. After eating carbohydrates, our blood sugar levels rise, and the pancreas responds by releasing insulin. This hormone acts like a key, opening channels in muscle, liver, and fat cells to absorb glucose and store it for energy. Yet in sedentary individuals, these channels are often underutilized, and the excess sugar circulates longer than it should. Movement during this post-meal period essentially amplifies the effectiveness of insulin, accelerating the transport of glucose into muscles where it can be used immediately for energy rather than stored as fat. Researchers have demonstrated that walking for even 10 to 15 minutes after a meal can lower postprandial glucose spikes. But what is particularly compelling is that targeted muscle engagement, such as standing, gentle resistance movements, or light dynamic activity, can enhance this effect even more. This is not about running a marathon, but about strategic interaction with our biology, a precise, thoughtful response to the natural rhythm of our blood sugar. Doctors and nutritionists have increasingly emphasized the importance of this post-meal window for patients with diabetes or prediabetes. It is not only about reducing immediate spikes in blood sugar, but also about training the body over time to respond more efficiently to insulin. Insulin sensitivity is not a static characteristic. It fluctuates daily, influenced by factors like sleep, stress, and physical activity. By choosing to engage in movement immediately after eating, we send repeated, consistent signals to the body that glucose should be directed toward energy production in the muscles rather than remaining in circulation or being stored inefficiently in fat cells. Over weeks and months, this pattern reinforces metabolic efficiency, essentially teaching the muscles to act as active participants in blood sugar regulation. The simplicity of this approach is deceptive. It taps into a sophisticated biological principle that humans have overlooked in modern lifestyles where prolonged sitting after meals is the norm. Beyond the physiological mechanisms, there is also a psychological and behavioral dimension to post-meal movement. When people intentionally engage their bodies after eating, they become more attuned to the relationship between food, energy, and movement. It cultivates a sense of presence, a mindfulness that bridges biology and consciousness. Patients often report that a short walk or gentle activity after meals not only helps stabilize blood sugar, but also improves digestion, reduces bloating, and enhances overall energy levels. This reinforces adherence to the habit, creating a positive feedback loop. The body responds favorably, the mind notices the effect, and the practice becomes self-sustaining. From a scientific perspective, this interaction between behavior and physiology is a critical component of long-term metabolic health. The most elegant interventions are often the ones that work quietly, consistently, and in alignment with natural biological rhythms. It is also important to understand that not all movement is equal. Casual pacing or aimless wandering has benefits, but engaging the larger muscle groups, those in the legs, core, and even the upper body, maximizes glucose uptake. These muscles act as powerful reservoirs for sugar when they are active, essentially clearing the bloodstream efficiently. Even gentle resistance or dynamic stretching can serve this purpose, signaling to the cells that energy is needed immediately. Scientific studies have shown that this post-meal activation can reduce the area under the glucose curve, meaning that blood sugar levels rise less dramatically and return to baseline faster. It is a precise alignment of biology and behavior, where timing, type of movement, and duration converge to optimize metabolic outcomes. The philosophy underlying this approach is rooted in respect for the body's inherent intelligence. Our physiology has evolved over millennia to handle food and energy in a rhythmic, responsive manner. In pre-modern societies, meals were often followed by movement, tending to animals walking or engaging in light labor, and our metabolism adapted to this pattern. Modern sedentary lifestyles disrupt these natural cycles, creating prolonged periods of elevated blood sugar and insulin resistance. By reintroducing mindful, well-timed activity after meals, we honor the body's original design and engage with it in a way that is both scientifically validated and deeply harmonious. Doctors who witness these changes in patients frequently remark that the post-meal habit, simple as it may seem, often produces measurable improvements in a surprisingly short time. It reminds us that the human body is not passive but responsive, that small, intentional actions can produce profound biological effects, and that timing is a force multiplier in our quest for optimal health. When we consider the act of moving our bodies, it's easy to picture walking, jogging, or other traditional forms of exercise, but the truth is that not all movement is created equal, especially when it comes to regulating blood sugar. The muscles of the human body are not merely instruments of mobility or strength. They are the largest and most metabolically active organs in our physiology, capable of absorbing and utilizing vast amounts of glucose when activated correctly. Walking engages some of these muscles, certainly, but the full potential of sugar clearance is only realized when we stimulate the major muscle groups in a purposeful, deliberate way. Think of the quadriceps, hamstrings, glutes, and core as highly efficient glucose sponges lying dormant until we call upon them. When activated, they pull sugar from the bloodstream far more rapidly than casual walking, and they do so by converting chemical energy into mechanical work, creating a cascade of cellular processes that not only lower glucose but also enhance insulin sensitivity. Physicians who work with patients struggling with elevated blood sugar often emphasize this point. The difference between random movement and targeted engagement is profound, and understanding this difference allows us to harness the body's natural systems rather than fighting against them. The science behind this is both elegant and precise. Glucose transport into muscle cells depends on the presence of insulin, as well as the recruitment of specific molecular transporters, the GLT4 proteins, which sit on the edges of muscle cells waiting to pull sugar in. When we engage large muscle groups through even gentle but intentional contractions, we stimulate these transporters directly, allowing glucose to enter the cells more efficiently and independently of insulin to some degree. This dual mechanism is particularly powerful for individuals with insulin resistance because it bypasses the bottleneck that often slows glucose clearance. Even low-impact exercises such as squats, lunges, standing marches, or dynamic stretching, when performed in a mindful and deliberate pattern, signal to the muscles that energy is required. This signal is communicated at the cellular level, prompting muscles to absorb glucose rapidly and reduce the burden on the bloodstream. It's a fascinating interplay between anatomy and biochemistry, demonstrating that the body responds not just to movement, but to intelligent, well-timed, and well-directed movement. The intensity of muscle engagement is another critical factor. While it may seem counterintuitive, maximal exertion is not necessary for optimal glucose clearance. Studies have shown that moderate, sustained engagement of large muscle groups can be more effective for immediate post-meal glucose reduction than longer periods of low-intensity walking. This is because activating more muscle fibers simultaneously recruits a larger number of glucose transporters and increases blood flow to these regions, which in turn improves nutrient delivery and waste removal. Doctors and exercise physiologists describe this as metabolic efficiency, getting the most sugar, burning effect from the least amount of time and effort. It also makes the habit far more sustainable, especially for older adults, individuals with limited mobility, or those who find traditional exercise routines intimidating. The body responds best not to extremes, but to repeated, thoughtful engagement of its most potent systems, allowing the natural biochemistry of muscles to do the work it was designed to perform. There is also a deeper layer of understanding when we consider why muscles have this unique role in blood sugar regulation. Muscles are not simply passive storage sites, they are active participants in energy homeostasis, capable of adapting to the demands placed upon them. When we consistently engage them after meals, we are, in a sense, training them to become more efficient at their primary metabolic function. Over time, this leads to enhanced insulin sensitivity, increased mitochondrial density, and improved oxidative capacity, all of which contribute to better overall metabolic health. Doctors observing these changes often report remarkable improvements in patients who adopt these simple post-meal movements, noting that they experience fewer sugar spikes, better energy levels, and sometimes even improved mood and cognitive clarity. The science confirms what our experience tells us intuitively. When we work with the body's design rather than against it, the results are both measurable and profound. Moreover, engaging major muscle groups efficiently has benefits beyond glucose control. It enhances circulation, supports joint health, and improves posture and balance. By incorporating movements that require coordination and activation of multiple regions simultaneously, we create a physiological environment in which sugar is rapidly utilized for energy rather than stored as fat. This is particularly important in the modern context, where sedentary behavior and prolonged sitting have disrupted the natural cycles of glucose metabolism. Even brief sessions of targeted muscle engagement, when performed consistently, counteract these effects, reminding the body of its inherent capacity to handle nutrient surges gracefully. Physicians increasingly recommend such strategies, not as a replacement for other lifestyle interventions, but as a foundational tool that integrates seamlessly with dietary awareness, mindfulness, and moderate aerobic activity. Perhaps the most profound aspect of this approach is the simplicity and accessibility it offers. Unlike structured gym sessions or complicated exercise regimens, activating major muscle groups can be accomplished with minimal equipment, often simply using the body itself. The act of rising from a chair, performing a few controlled squats, or engaging in a series of standing leg lifts after a meal becomes not just an exercise routine, but a dialogue with the body, a mindful practice that acknowledges the rhythms of digestion and metabolism. Doctors emphasize that the habit's effectiveness lies in its repeatability and intentionality. It is the cumulative effect of these small, deliberate movements, repeated consistently after each meal, that transforms the body's response to sugar. Over time, the muscles become not just reactive but anticipatory, prepared to absorb and utilize glucose efficiently, turning a simple daily habit into a powerful tool for metabolic resilience. Engaging the major muscle groups efficiently after eating also illustrates a broader principle about human physiology. Our bodies are designed for interaction, not passivity. Glucose does not simply vanish, it requires a signal, a demand, a movement that tells cells, now we need this energy. Walking engages some muscles and provides modest benefits, but the full metabolic orchestra is only activated when we consciously call upon the body's largest, most powerful systems. The science is clear. The doctors are observing it in clinics worldwide, and the experience of those who adopt these practices confirms that the body responds with remarkable fidelity. It is both humbling and empowering to realize that such a simple, accessible strategy, targeted engagement of the major muscle groups, can profoundly shape the trajectory of our metabolic health, harnessing the innate intelligence of our physiology in a way that is efficient, elegant, and sustainable. Movement is often seen simply as a way to burn calories or improve fitness, but when it comes to blood sugar regulation, the type and quality of movement matter more than most people realize. Walking is frequently recommended because it is accessible and gentle, but it only partially engages the body's largest reservoirs for glucose, the major muscle groups. Muscles such as the quadriceps, hamstrings, glutes, and core are not merely structural or functional components for mobility. They are highly metabolic organs capable of absorbing and utilizing tremendous amounts of glucose when activated properly. When these muscles are engaged efficiently, they pull sugar from the bloodstream far more effectively than casual walking, and this process begins at the molecular level, demonstrating that the body is a precise and responsive system rather than a passive machine. Doctors who work with patients struggling with prediabetes or type 2 diabetes often observe that targeted muscle engagement after meals can produce rapid reductions in postprandial glucose levels, sometimes exceeding the effects of more traditional cardiovascular exercise performed at random times. This is because muscles are not just passive storage sites, but active participants in energy regulation, capable of sending and receiving biochemical signals that influence the entire metabolic system. The cellular mechanics underlying this process are fascinating. Glucose enters muscle cells primarily through transporters called GLUT4, which reside along the cell membrane, waiting to absorb glucose when activated. These transporters respond both to insulin and to muscle contractions themselves. When large muscle groups are engaged, even through low or moderate intensity movements, these transporters move to the surface of the muscle cell, allowing glucose to enter efficiently. In effect, the muscles become sponges, absorbing sugar directly from the bloodstream and reducing the load on circulating insulin. This dual mechanism, insulin-dependent and contraction-mediated glucose uptake, is particularly advantageous for individuals with insulin resistance. It provides a route for glucose clearance that does not rely solely on the body's sometimes impaired hormonal signaling, allowing blood sugar to normalize more rapidly after meals. The science behind this is elegant. The body has evolved to use muscles as a primary energy sink, and targeted engagement ensures that this system is utilized optimally rather than leaving excess glucose circulating and potentially causing oxidative stress or inflammation. Engaging large muscle groups is not about maximal effort or exhaustion. It is about intelligent recruitment of fibers. Moderate, controlled contractions recruit a substantial number of muscle fibers simultaneously, which dramatically increases the muscle's capacity to absorb glucose. Unlike casual walking, which engages a limited number of fibers intermittently, purposeful activation of multiple muscle groups at once maximizes the metabolic effect in a shorter period. This is why movements like squats, lunges, standing marches, or gentle resistance exercises can be more effective for blood sugar regulation than longer durations of low-intensity walking. It is an efficient system. Quality and precision of movement outperform quantity alone, allowing the body to respond with remarkable metabolic efficiency. Doctors and physiologists often highlight this point, noting that even brief sessions of targeted engagement repeated consistently throughout the day can improve insulin sensitivity and reduce post-meal glucose spikes more effectively than more strenuous but poorly timed exercise. The benefits of engaging major muscle groups extend beyond glucose clearance. When muscles are activated, blood flow increases, delivering oxygen and nutrients while simultaneously supporting the removal of metabolic byproducts. This enhances not only energy utilization, but also overall tissue health, including